So let's talk about breath. Breathing might seem obvious and automatic, but most of us have forgotten how to breathe deeply and correctly. Now, this is really important for controlling stress, inflammation, bad bacteria overgrowths, and even mood issues like anxiety. Here's why. When our nasal cavity gets congested, airflow goes down and bacteria are allowed to flourish. They replicate, and this leads to infections, colds, congestion, sinus infections. And then when we have more congestion, it gives us no option other than to breathe from our mouth, and our airways collapse. So once oxygen falls below 90%, our blood can't get enough of it to our body tissues. And if this goes on long enough, it can lead to heart failure, depression, memory problems. Sleep apnea and any amount of snoring drives oxygen levels down and inflammation levels up. So mouth breathing causes us to lose 40% more water too, which contributes to chronic dehydration, constipation, leaky gut, weight loss resistance. Our nose is really critical because it cleans the air and moistens it for easier absorption. Nose breathing triggers a cascade of hormones and chemicals too that lower the blood pressure and ease digestion. It responds to all the stages of our menstrual cycle. It regulates heart rate, opens vessels, stores memories. The density of your nose hairs even helps to determine whether you're suffering from asthma. So about 2/3 of adult onset asthma are actually related to mold exposure, and thicker hairs might keep out those spores. So each breath we take influences every internal organ, from our heart rate to digestion, mood, and arousal. It's like a power switch for our autonomic nervous system. Now, autonomic and parasympathetic nervous systems serve opposite functions. So parasympathetic regulates our relaxation and restoration, like during a long massage or when you salivate before meals. Your brain pumps these feel-good serotonin and oxytocin chemicals into your bloodstream, loosens bowels to eliminate. The more deeply and softly we breathe, the slower our heart rate becomes and the calmer we become. Now, sympathetic opens up our organs, preparing them for action, especially when we take quick, short, shallow breaths. This state of our body kind of redirects blood to our stomach and bladder, or away from the stomach and bladder to vital organs like our brain. It pumps adrenaline, blood vessel constriction, eases pain, minimizes blood loss if we get injured, and makes us lean and mean to fight. But we can only sustain this for really short bursts, and when it's constantly activated throughout our day, it drives up inflammation and blood sugar, and that's not good long term. So our nostrils actually have a circadian rhythm. They pulse, they kind of open and close like a flower in response to our mood, our emotional state, possibly even the sun and moon. So alternate nostril breathing is one of many deep breathing practices you could try out. Now, our right nose is like a gas pedal, speeding up circulation, body temp, cortisol, blood pressure, heart rate. The right side actually activates the sympathetic fight or flight mode. It feeds more blood to the opposite side of our brain, specifically the prefrontal cortex, which is associated with logical decisions and language. So if you put your index finger over the left nostril, inhale and exhale several times through the right nostril to help with digestion before meals. Now, the left nostril has the opposite effect, and it's kind of like the brake system to the right's accelerator. Our left nostril is more connected with our parasympathetic rest and digest system, lowering temperature and blood pressure, cooling off our body, reducing anxiety. It shifts blood flow over to the right side of the brain, which is our more creative thought and emotions side. So during these deep, restful stages of sleep, our pituitary gland is this pea-sized ball at the base of our brain. It secretes hormones that control the release of adrenaline, endorphins, growth hormone, and other substances, including vasopressin. So if you wake up to pee a lot in the night, that's the chemical that communicates to our cells to store that water. It's how we sleep through the night without feeling thirsty or needing to urinate. So if your body has enough time in deep sleep, or if it doesn't, as with an apnea, vasopressin then doesn't get secreted normally. Our kidneys will release that water, and that triggers this need to urinate and signals to our brain that we're thirsty. So then we drink more and pee more. Mouth breathing contributes to bad breath and cavities even more than sugar and diet. So some doctors recommend mouth taping by putting a small strip of medical grade tape over your lips. And sinuses release this huge burst of nitric oxide at night. And so it's this molecule that increases circulation, delivers oxygen to our cells, and helps with immune function, weight, mood, even sexual function. They're all really influenced by nitric oxide. It's actually how Viagra works, by releasing nitric oxide into our bloodstream, which opens up our capillaries. And it's boosted by 6x when we nose breathe, which is one reason we can absorb a lot more oxygen through our nose than through our mouth. So if you're mouth taping, work from a few minutes up to all night, and it should work within 6 weeks. Now, Dr. Ann Carney at Stanford says it's really a case of use it or lose it. So when we don't use our nose, it will start to atrophy, and snoring and sleep apnea usually follow. So keeping the nose consistently in use will train it, the nasal cavity and the throat, to stay open. And mouth breathing is not good. It leads to blood pressure, high blood pressure, cancer, mood disorders, ADHD, and no amount of snoring is normal. Starting around age 30, we start to lose memory, mobility, muscle, bone with each passing year. So in addition to our ability to breathe properly. And so our chest and rib cage starts to collapse inward, and these muscles surrounding our lungs prevent air from entering and exiting, which further reduce lung capacity. So between age 30 and 50, we lose about 12% of that capacity, and the decline accelerates, unfortunately, especially in women. So we're forced to breathe faster and harder, which just drives these problems like high blood pressure, immune disorders, and anxiety. But our internal organs are really malleable. They can change anytime. Like free divers increase that by 40%, but just moderate exercise like walking or cycling increases lung size by 15%. It's also a weight regulating system. So 8.5 pounds of fat come out through carbon dioxide for every 10 pounds lost. It's kind of like a water vapor, and then the rest is sweated or urinated out. So what our body really wants in order to thrive isn't short, shallow breaths. It's more air, more carbon dioxide. Another great exercise is a 4-7-8 breathing, and that can begin to have positive impacts on you in as few as 3 rounds. So Dr. Stephen Porges has studied the vagus nerve for 30 years. It's this meandering nerve. It goes from our brain, connects to all of our organs all the way down. And so when our bodies perceive high stress, the vagus nerve slows our heart rate, slows our circulation, slows our motility. What stimulates our vagus nerve? You guessed it, breathing. So it opens up this communication along the vagal network and relaxes us into this parasympathetic state. How we breathe is at the root of so much of our health, happiness, and longevity. So I hope this will encourage you to become a little more mindful of how you breathe and integrate one of these habits into your day.